All right, today we're going to break down a really fascinating new blueprint for the future of veteran healthcare. It's a total redesign, and the big idea is shifting the focus away from these giant centralized hospitals to a system that delivers care right in a veteran's own community. So let's dive in and see how it's all supposed to work.
And this quote right here, it really nails the whole idea in one sentence. It's about flipping the script. We're moving away from a system you have to travel to a system that's literally built around you. This is the fundamental concept, the bedrock for everything else we're about to explore.
That's the million-dollar question, isn't it? I mean, it's one thing to talk about these big, high-level ideas, but how does this actually change the day-to-day experience of getting healthcare? Let's get into the practical side of this new vision. So, what's the big idea here? It's huge. The goal is to transform the VA from what's basically been a collection of separate hospitals into one single, unified healthcare system. Think of it like a company that's 100% responsible for a veteran's total health and their outcomes. And you can see that shift right here. Instead of the default being, a long drive to a major VA medical center for almost everything, this new model is all about building a network that brings care as close to a veteran's front door as possible. Proximity, that is the new name of the game. So how do you actually build a system like that? Well, the blueprint is organized into what they call a three-tiered network. Just think of it as three interconnected layers of care, where each layer has a very specific and really important job to do. And here they are. Tier 1 is your local clinic, the CBOC. That's your new healthcare home base. Tier 2 is your local network of community doctors and specialists. And Tier 3 is the big one, the VA Medical Center, which now becomes a specialized hub. So let's pull back the curtain and see how each of these pieces actually fits together. All right, let's get into the nuts and bolts. We're going to look at the exact role each of these three tiers plays in a veteran's life. And we'll start with that all-important home base. In this new world, the CBOC, your local clinic, becomes the absolute center of your healthcare universe. This is your first stop, your main point of contact. It's kind of like your family doctor's office, but totally supercharged. It's the anchor for everything else. Now, check out this number, 70 to 80%. Let that sink in. This is the percentage of all veteran healthcare that's designed to happen right here, at the local clinic. We're not talking about a few checkups, we're talking about the overwhelming majority of your care. And it makes a ton of sense when you see what these CBOCs will handle. We're talking primary care, managing chronic conditions like diabetes, mental health support, and this is so crucial, it acts as the continuity hub. This is the team that knows you, manages your referrals, and helps you navigate the whole system. Okay, so what happens when you need to see a specialist, right? A cardiologist, an orthopedist, whatever. That's where Tier 2 comes in. And this isn't just sending you out to any random doctor. No, this is a carefully selected network of local providers who are plugged directly into the VA system. So this tier handles most of that routine specialty stuff, appointments, imaging like MRIs, lab work, even simpler hospital stays. But here's the absolute game changer. These community providers are all VA credentialed. They have to follow VA rules, and most importantly, they share all their data directly back into the system. So your home base, your CBOC, always knows exactly what's going on. And that finally brings us to Tier 3, the big VA medical centers. So if most of the care is now happening out in the community, what's left for these massive hospitals to do? Well, their role gets way more focused, way more strategic. They're no longer the default for everything. They're the specialized hub for the entire network. And this slide just lays it all out, plain and simple. The old focus? The hospital tried to be everything to everyone. The new focus is about being the absolute best at two things: providing the most complex, advanced medical care, what the source actually calls extreme medicine, and acting as the administrative brain for the whole network. So, on the clinical side, they're handling the really tough stuff: advanced cancer treatments, super complex surgeries, polytraumas, spinal cord injuries, and cutting-edge research. And then you've got the administrative role. They're like the quality control for the entire network, making sure community partners meet VA standards, handling governance, training, the whole shebang. Okay, so we've seen the blueprint. Now, let's get to the payoff. Why do all this? Why make such a massive change? What are the actual, tangible benefits this model is supposed to deliver for veterans and their families? Well, the upsides are pretty clear, and they're powerful. First off, and this is a big one, less travel means better, easier access to care, period.
Second, having that home base at the CBOC means you get stronger continuous care from a team that actually knows you. This whole integrated system also cuts down on costs by reducing duplicate tests and procedures. But ultimately, all of this is designed to deliver one thing: better health outcomes for veterans.
Let's just zoom out one last time and look at the real strategic importance of all this. Because this isn't just about shuffling where appointments happen. This is about fundamentally changing what the VA healthcare system is. This, right here, is the whole ballgame. It's a transformation from basically a scattered collection of buildings into a single, truly integrated healthcare system. A modern organization where every single part works together with a common goal, using shared data to get the job done. And that brings us to the ultimate goal. The whole point of this massive undertaking is to build a system from the ground up that is optimized for three key things: getting the best possible health outcomes for veterans, being a smart and responsible steward of taxpayer money, and making sure the VA is strong and sustainable for generations of veterans to come. Which leaves us with a really fascinating final thought to chew on. We've seen how this model could completely transform veteran care by putting the patient right at the center of a local, connected network. It really makes you wonder, is this kind of community-first model, this idea of a home base supported by specialized hubs, is that a blueprint for the future of all healthcare? A pretty powerful question. Thanks for watching.